When you have rapid breathing, is it breathing or rapid breathing? Okay, we have rapid breathing. Why is my tongue now allowing me to call the breathing? Okay, we have rapid breathing. I know it's breathing or breathing or whatever, but I want to call it breathing. When you have rapid breathing in medical term, we call it. Hi guys, welcome back to my channel. My name is Vera, and in today's video I'm going to be sharing with you 20 common medical conditions and their medical terms. Basically, you've gone to the hospital and you heard your doctor say a lot of medical jargons. You don't have a clue about what he is saying, where it's like phthisis, epistaxis, hyperemesis gravidarum, myocardial infarction. You've heard a lot of that, but I'm going to be sharing with you the common ones you hear every day in the hospital. So sit tight and watch this video to the end. And also, you're getting a bonus because I'm going to be explaining some of these disease conditions, not in a broader sense, but in just lighter sense, so that you understand the next time you hear it from somebody or from your doctor or a nurse or any medical practitioner. But before we get right into today's video, I want you to give this video a thumbs up, subscribe to this channel, turn on your post notifications so you get notified each time I upload on this channel. And with that being said, let's get right into the video. Welcome back, guys. So I have my phone here where I wrote some disease conditions that I'm going to be sharing with you today. I wrote them down on my notes so that I will be put together in this video, so I won't be everywhere. Okay, so let's get right into the video immediately. So the first disease condition that I have on here, which is the common name, I'm going to give you the common name first, and then I'm going to give you the medical term. So we're coming off easy. We have the high blood pressure. This is the one we all know as HBP, or some people call it high BP. So the medical term for it is hypertension. This commonly means abnormal high blood pressure. So the next one is low blood pressure, which we call low BP. The medical term is hypotension. So this is the trick here. When you hear something is hyper, it means it's high, and when you hear it's hypo, it means it's low. So hypotension means abnormally low blood pressure. The next one is heart attack. You know, when you say somebody is having heart attack, it's just so common that it's so common. I'm distracted by the messages I'm getting on my phone. I'm sorry. Welcome back. I'm sorry for that. Okay, let me put my phone on do not disturb so that it will make things easier for me, because my attention span is very slim. Okay, yeah. So the next one is heart attack, as I've already said. So the medical term for heart attack is myocardial infarction. Myocardial infarction is basically that there is insufficient blood supply to the heart. The next one is stroke. Stroke is very common. Everybody calls stroke. Oh, he's having stroke. Oh, she's having stroke. But what do you think the medical term for stroke is? If is in the hospital, they might just say CVA, but the full meaning of CVA is cerebrovascular accident. This is when somebody has restricted blood flow in the brain. When you hear cerebro, you just know that we're talking about the brain. So the next one is fainting. We hear about fainting maybe when somebody is walking on the way and loses consciousness and just faint and all. The medical term for fainting is syncope. Some persons might call it syncope. I don't know. It is spelled SYNCOPE. Syncope. I call it syncope. And the meaning is just loss of consciousness. The next one here is nose bleeding. Nose bleeding is when you lose blood from your nose. Obviously, it's explanatory. The medical term is epistaxis. Next one is vomiting. Vomiting is when you throw up, right? When you are expelling maybe what you ate or drank or whatever from the stomach outwards. The medical term for vomiting is emesis. So when you hear your practitioner say she is having emesis or she had emesis, it's talking about vomiting. For pregnancy, there is a complication called hyperemesis gravidarum. This is when you are having excessive hyper. Remember, hyper has to do with high. Excessive vomiting, gravidarum, that's the person is pregnant. The next one is cough. We call cough ptosis, and cough is just like expelling air from the lungs. The next one I have here is difficulty breathing. Difficulty breathing, the medical term is dyspnea. This is when somebody has trouble or difficulty breathing. The next one is rapid breathing. The medical term is tachypnea. So when something is rapid, like it's fast, we associate it with tachy. So this really means abnormal fast breathing. The next one I have here is slow heart rate. When you have slow heart rate, we call it bradycardia. And bradycardia is when you have abnormal heart rate less than 60 beats per minute. For fast heart rate, which is the next one, we call it tachycardia. And tachycardia is when you have, what's it called, high abnormally high heart rate, more than 100 beats per minute. That is tachycardia. The next one we have here is chest pain. The medical term is angina pectoris, and angina pectoris means that there is presence of chest pain due to low blood flow to the heart. The next medical condition we have is headache. Headache is the most common one. Everybody has headache here and there. So now imagine you come to the hospital and then the doctor will not tell you are having self-allergia, which is the medical term for headache. You'll be like, doctor, please, how much will it take to cure that one? Headache simply just means pain in the head. The next one is running nose. Running nose means rhinorrhea. Rhinorrhea is excess nasal discharge. When you are having nasal discharge, imagine you come to the hospital with your baby, not be like your baby is having rhinorrhea. Let me not bite my tongue. Rhinorrhea, and you not be like, doctor, is everything okay? Guy, your baby is just basically having running nose, because the medical terms be wowing, like they are really a lot. The next one we have is sneezing. Our common sneezing that we do at the medical condition for sneezing is stentation, and sneezing is just when you're expelling air from your nose. The next one is eye redness. Eye redness is the one we are very acquainted with. They call it Apollo. So when your eyes are red like this, a medical term is conjunctivitis. You know this place is called conjunctiva. This place I say is called conjunctiva. The meaning is that you are having inflammation of the conjunctiva. The next one we have is blood in urine. We call it hematuria. The meaning is that there is presence of blood in your urine. By the color of the blood, you shall know that there is the presence of blood in your urine. But the medical term is hematuria. And the next one is painful urination. Painful urination is dysuria. Dysuria means painful urination or discomfort while urinating. The last but not the least is difficulty swallowing. Difficulty swallowing is basically dysphagia. So yeah, this is the end of today's video. Hope you did learn something. Hope the next time you go to the hospital that doctor is not going to confuse you with a very mighty name that you feel very lost about and wonder what kind of procedure will be carried out to fix the medical condition. We also know that when a doctor uses a medical term that you do not understand, make sure to ask the doctor what it actually means in a layman. The doctor, any medical practitioner at all, ask them what the layman meaning of what they said is, so that you can understand better. But this video, I hope it helped you. Hope you did enjoy watching it. Thank you for watching. Please make sure to give this video a thumbs up, subscribe to this channel, turn on post notifications so you get notified each time I upload on this channel. And with that being said, bye.